This sort of posture inevitably brings the summits of the spinous processes closer together. In contrast, this horse has lumbar kyphosis. So the muscles, the epaxial muscles and the middle gluteal muscles, are reasonably adequately developed, but the horse has abnormal flexion of the lumbar vertebral column, resulting in actual kyphosis. I think with every horse it is important to visually appraise and also palpate the alignment of the summits of the spinous processes. In this horse on the left, we see apparent lumbar kyphosis, which was associated with malalignment of the summits of the spinous processes, reflecting concurrent scoliosis. Horses with this type of conformation generally cannot perform well. And this is another horse in which we can see that there is lack of alignment of the spinous processes in the lumbar region, highlighted by palpation on the left and the placement of the yellow dots, and also highlighted in the right scintigraphic image. In this horse, we can see abnormal flattening of the withers, and we have to ask, is this congenital or acquired? Is it acquired through a previous fracture of the thoracic spinous processes? That in itself carries with it generally a good prognosis. However, the change in width of the withers region may require the acquisition of a specially fitted saddle to accommodate this abnormal shape. Appreciation of muscle atrophy in the cranial thoracic region, in the region behind the scapulae, behind the withers, is very important, because this is usually the reflection of the presence of a chronically ill-fitting saddle, and associated with that, there will be abnormal function of the underlying muscles. Correction of saddle fit is imperative for restoration of normal muscle function. The shape of the neck is very much influenced by the position of the head and neck, as illustrated by these three photographs. This horse has got well-developed neck musculature. The trapezius and splenius muscles are well developed. We do not see overdevelopment of the ventral strap muscles of the neck, particularly sternocephalicus. In contrast, in this horse, we can see a concavity in the caudal aspect of the neck, immediately in front of the withers. In association with this, the trapezius muscles are less well developed, splenius is less well developed, and sternocephalicus is abnormally well developed. This means to me that this horse has not been working with a correct head and neck posture. And if we look at the horse proportionally, the entire neck region is less well muscled than the thoracolumbar and pelvic regions. This is also a horse in which we have abnormal prominence of the sternocephalicus muscles. The brachiocephalicus muscles are also rather overdeveloped. We've got loss of muscle mass over the trapezius area and the cervical serratus muscles, resulting in this large hollow in the caudal neck region, likely reflecting caudal neck dysfunction. And in this horse, we can see a number of features. We've got the concavity on the dorsal caudal aspect of the neck. There's overdevelopment of the sternocephalicus muscles. The horse is standing with a slightly camped under posture with the forelimbs, and we have abnormal prominence of the pectoral muscles. And we also have poor tone in the abdominal muscles.